Are you a Medicare Advantage organization, or do you code for one? Let's take this one step further. Does a Medicare Advantage organization sit under your compliance oversight? The OIG has audited Medicare Advantage organizations to determine whether Medicare Advantage organizations submitted certain diagnosis codes, ones that when coupled with other data indicated that the codes were at high risk for being miscoded. To CMS for use in CMS's risk adjustment program, and approximately 70% of those diagnosis codes were not supported in the associated medical records. Now, let's talk real numbers. Did you know Medicare Advantage loses billions of dollars every year due to inaccurate coding? That's not just chump change. That's enough to fund life-saving treatments, cutting-edge technology, and a whole lot of extra lattes and tea for overworked coders. Hi everyone, and welcome back to our channel. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies regarding health information, healthcare compliance, the revenue cycle, and how to become a certified, marketable medical coder. In this video, we are focusing on helping Medicare Advantage organizations, their compliance staff, and medical coders get around the tricky territory of coding rules and regulations. And let me tell you, the OIG just dropped a brand new map to save you from getting lost. This, my friends, is the Office of Inspector General's, or OIG's, brand new toolkit for identifying high-risk diagnoses in Medicare Advantage. Now, don't let the title intimidate you. Think of it as your secret weapon for spotting coding errors before they become audit nightmares. With this toolkit, you can identify and fix risky codes, streamline your billing process, and even save your organization a tidy sum of money. We're talking millions, folks, millions. And trust me, when it comes to compliance, every dollar saved is worth celebrating with a victory dance, a line dance even. Let's talk about high-risk diagnosis. These are often vague or complex that can easily trip up even the most seasoned coder. Take sepsis, for example. It's often a judgment call, and boom, you might end up with inaccurate coding. Dual coding, up coding, down coding, it's a slippery slope. Now, the OIG doesn't play favorites. They've identified a whole gang of these high-risk diagnoses: congestive heart failure, chronic kidney disease, even that tricky old friend, pneumonia. If you have followed the OIG work plan, you have already heard and seen some of the commentary regarding these high-risk diagnoses. But how are these things caught? The OIG's got some fancy tech looking for suspicious patterns. They look for things like frequency. Is this diagnosis popping up too often for the patient's age or condition? Red flag. Discrepancies. Does the code match the symptoms and procedures? Inconsistency alarm. Specialty surprises. Did a cardiologist suddenly diagnose sepsis? Time to raise an eyebrow. Now, here's the real clincher. Miscoding isn't just a paperwork headache. It can impact the life of your patient. Inaccurate risk assessment means that they might not get the care they need, or worse, get treatments they don't. That's why we gotta be about the business of accuracy. All right, let's go from being reactive and embrace being proactive. That's where risk mitigation comes in. Your secret weapon against audits and coding chaos. Think of the OIG Toolkit as your crystal ball. It helps you identify potential coding issues within your own organization before the OIG even knocks on your door. Boom! No more surprises, just smooth sailing towards compliance. So how do we use this magic toolkit? First, data analysis is your friend. The toolkit includes handy SQL or SQL code snippets you can plug into your systems to uncover suspicious coding patterns, frequency analysis, age or diagnosis discrepancies, provider trends. These are your red flags in the data jungle. But data alone isn't enough. We need coding education and training for our medical coders and providers. Think ongoing workshops and regular refreshers on these high-risk diagnoses. Knowledge is power. And finally, don't forget to build a culture of compliance within your organization. Encourage open communication. Celebrate coding accuracy and reward those who go the extra mile to follow the rules. Remember, compliance isn't a chore, it's a team effort. Proactive risk mitigation is your shield against coding kryptonite. Embrace the toolkit, train your team, and build a culture of compliance. That's how you turn audit fears into victory cheers. Last but not least, let's talk money. Because accurate coding isn't just about ticking boxes, it's about saving big bucks for your Medicare Advantage organization. Think of it as your secret formula for financial immunity. Every miscoded diagnosis is like a leaky faucet draining your money. Improper payments, recoupments, unnecessary services, these are the evils of the budget that we must defeat. But here's the flip side. Accurate coding leads to improved revenue. The OIG Toolkit helps you capture the true risk profile of your enrollees based on accurate diagnoses. That means fair risk adjustment calculations and potentially more money flowing your way. And it's not just about the bottom line. Success stories can abound. Wouldn't you want to use the toolkit to identify and correct coding errors, possibly saving a cool $1 million in just 1 year? Is this something that would be helpful for you or your organization? Let me know in the comments. Or how about seeing a 15% increase in your risk adjustment payments after implementing the toolkit? How cool would that be? Type cool in the comments if you think that would be cool. The benefits go beyond the financial. Accurate coding ensures your enrollees get the right care at the right time. No more undercoding leading to missed opportunities for treatment, or overcoding resulting in unnecessary procedures. Guess what? Everyone wins. So let's recap. Accurate coding saves money, increases revenue, and improves patient care. What's not to love? Download the OIG Toolkit today and unlock your coding superpowers. It's packed with resources, data analysis tools, and practical guidance to help you conquer these coding challenges. And if you need a coding sidekick, PRN is here to lend a hand. We offer expert support in implementing the toolkit, training your team, and building a rock-solid culture of compliance. Don't wait for the OIG to knock on your door. Take control of your coding destiny. Embrace accuracy and watch your finances and your patients flourish. Remember, the power of proactive compliance is in your hands. So consider liking, sharing, and subscribing to my channel for regular updates on medical coding, compliance, health information, and trends in the healthcare industry. Please feel free to ask any questions or share your ideas in the comments section below. Also, if you want to know more about medical coding, compliance, the revenue cycle, and healthcare in general, watch one of these videos. Until next time, I'm Clarice Warner, the girl with the pearls, the founder and senior education director of the Professional Reimbursement Network, LLC, where coding education is key. Remember, be safe, be kind, and don't wish for it, work for it. Thanks so much for watching.